In this section, we are going to review the osteopathic techniques, the same ones that were used in the 1918 Spanish flu pandemic. These techniques are safe and easy to learn. There are, however, at least 3 contraindications that we should be aware of. The first is in the case of extreme osteoporosis or bone softening. Unfortunately for these individuals, their bones can spontaneously fracture at any time, and certainly could occur while you're applying these maneuvers. The second would be if a patient has a recent rib fracture, possibly produced by coughing or sneezing too hard. Then you would not want to move that rib that is already fractured. And finally, if the patient is known to have cancer, which involves the bone, then in such a patient, if it involves the bones of the rib cage or the spine, you would not want to apply these approaches to that patient. Before we demonstrate the approaches that will be used to treat our patients, we need to review a little anatomy. The spine is a column of bones, which begins at the base of the skull and continues downward to the tailbone. In between each pair of bones, nerves arise, which move forward into the organs of the body and provide them with nerve supply. It is important that we address those nerves that move forward by addressing the spine itself. In addition to that, there are muscles on either side of the spine, long columns of muscles, which become tight and develop spasm and knots when the patient has been coughing or sneezing or is simply ill for a long period of time. We will be addressing these muscles as well. Finally, we will be addressing the ribs. The ribs come out from the spine, come downward and forward, attaching to the sternum or breastbone in front. In this section, we will actually be demonstrating the same osteopathic techniques that were applied so successfully in the 1918 Spanish flu epidemic. These techniques have not been lost to history, fortunately, and we're going to demonstrate them now. These techniques will be used to loosen the spasm along the spine of the paravertebral musculature first. That will be the first movement that we make. So we have the patient turn facing us in their bed, and we raise their arm up and put it comfortably cradled with our arm. Draw their knees up to keep them secure on their side. Then we use our fingers to work the paravertebral muscles, lifting them upward and stretching them out so that any spasm in the paravertebral muscles as they come along the spine can be released. And again, we're using our fingers to do this. You can go up and down the spine several times as needed until you feel the muscles release under your hands and let go of the spasm that will definitely be there if the patient has been coughing and sneezing repeatedly. The same position can be used for raising the ribs, which is a way of lifting the ribs so that the patient can breathe more easily. In between each pair of ribs are muscles that hold the ribs to each other, and by freeing these up, the patient's able to move air more readily into the lungs and out of it. Similar to the release of the spasms along the vertebra, the position stays the same, but your hands move to the outside angle of the rib cage towards the bottom, and you lift the ribs upward towards the head of the patient, again using your fingers and your body to pull the rib upward towards the head of the patient. You move up one rib at a time, stretching as they go. Now that we've relaxed the muscles along the spine and freed up any spasm that was present, the next step is to have the patient sit up on the side of the bed. What we're going to do is spring the individual bones of the spine. Remember that nerves come out from each pair of bones along the spine and go to the lungs and the air tubes within. By stimulating these nerves, by moving each individual pair of vertebrae, we can help the patient breathe and help with the airflow into and out of the lungs. So we're going to have the patient cross her arms and put them in front of her forehead and then lean forward, resting against us, using our body to support the patient, being careful not to strain ourselves as we treat the patient. Reaching back to the spine with our fingers in the lower spine, we bring a springing motion to it by drawing the patient forward, pushing with our torso against the arms, while drawing with our fingers, pulling the spine towards us. And we gradually move up the spine, just as I'm doing now, springing each pair of vertebrae individually a couple of times. We continue upward. And if there's any area of restriction, any area of tightness, any area that feels like it's not moving well, spend an extra few springs at that area. So we continue all the way up the spine, even into the upper back. Now, at this point, and from the same position, we move to our next phase, which is actually elevating the ribs. In osteopathy, this is referred to as rib raising. The point here is the more we can move the ribs and release any restriction in the muscles between the ribs, the easier it is for the patient to breathe. So we're going to use the same position, again, arms crossed, leaning up against us. Only this time, instead of being at the level of the spine, we're going to move outward to what we call the angles of the ribs. This is at the outside edge of the rib cage, and you can feel the ribs in that area. And what you do is you simply lift upward on the ribs, upward in this case meaning towards the ceiling, while following the same motion we did before, pushing back on the arms with your torso while lifting upwards with your hands. And we work the entire rib cage. If the patient is coughing continually, or if you simply don't wish to stand in front of the patient while providing treatment, you can stand at the side of the patient in the same position and accomplish the same thing. The spinal springing, and even the rib raising can be done from the side. Again, we're only demonstrating from one side, but obviously you need to treat both. The final portion of our treatment sequence is to use the arm and its muscular connections from the shoulder to the rib cage to help move the upper ribs. We do this by moving the arm in sweeping circles while applying pressure to the collarbone, which is the clavicle, this bone that goes from the chest out to the shoulder. And we put pressure on that bone upward towards the head using our fingers while making sweeping circles with the arm. 3 circles in one direction and 3 at least in the other. In providing this treatment, it is important not to exhaust the patient nor to let the patient become chilled. Therefore, the treatment, the entire sequence, should not last longer than 10 minutes. It should be done 3 times a day when the patient is very sick, and cut back to 2 times a day when the patient starts to get well.